listening to AM 1340 KROS, Clinton, Iowa.
FM 105.9.
And KROSradio.com.
It's time for Healthy Living. I'm your host, Dr. Richard Betts. This program provides information to help you stay healthy, happy, and full of vitality so you can contribute at the highest level to your family, friends, church, and community. I start each show with a disclaimer. It is important that you contact your healthcare provider before implementing anything I may talk about. Hi, I am Dr. Richard Betts, and today's Healthy Living topic is focused on how excess weight can cause cancer and how sugar can decrease the immune system's ability to fight disease. And not only that, but also fight cancer. So let's dive right into the information. First, I'd like to discuss excess weight, obesity, and morbid obesity, and cancer. My first resource I go to is usually the CDC website. And here is a synopsis of the CDC and what they have to say on the subject. Under the title, Obesity and Cancer, it states this: being overweight or having obesity increases your risk of getting cancer. Now, you may be surprised to learn that being overweight or having obesity are linked with a higher risk of getting 13 types of cancer. The article goes on. These cancers make up 40% of all cancers diagnosed in the United States each year. Many things are associated with cancer, but avoiding tobacco use and keeping a healthy weight are two of the most important steps you can take to lower your risk of getting cancer. Now, the website further explains BMI. Now, BMI, if your BMI is between 25 to 29.9, you are considered overweight. If your BMI is 30 and above, that is obesity. Now, the interesting thing is, and sad thing about the CDC website is it does not indicate that greater than 40 on the BMI is considered morbidly obese. Now, I find this information on the CDC website a little bit disconcerting because we have such a huge percentage of our population that is considered overweight, obese, or morbidly obese. It used to be that we didn't have a whole heck of a lot of morbidly obese people, and in today's world, 75% of the population, that includes adults and children, are considered either having excess weight, obese, or morbidly obese. Now, if you get your health information primarily from the CDC, you need to take the information with a grain of salt, as this is a perfect example that the CDC has not given all of the information. So when I research, I always have 2 or more sources to find out as much good information as possible. So this next source, actually I'm going to ask a question. So which cancers are related to obesity? This is still on the CDC website. So it states being overweight and having obesity are linked with a higher risk of getting 13 kinds of cancer. These cancers include adenocarcinoma of the esophagus, breast cancer in women who have gone through menopause, colon and rectum cancer, uterus cancer, gallbladder, upper stomach, kidneys, liver, ovaries, pancreas, thyroid, and meningioma, which is a type of brain cancer, not a good cancer at all, and multiple myeloma. The next question on the CDC's website is, how can obesity cause cancer? It states overweight and obese can cause changes in the body that help lead to cancer. These changes can include long-lasting inflammation and higher than normal levels of insulin, insulin-like growth factor, and sex hormones. The risk of cancer increases with the more excess weight a person gains and the longer a person is overweight. The next question on the website is, how can I lower my risk? And that's a great question. So according to the CDC website, it says you can achieve a healthy weight by making healthy lifestyle choices. You can reduce your risk of obesity-related cancer by following a healthy eating plan and getting regular physical activity. Now, I have treated many overweight and obese people, and some of you listening to this program know that physical activity is definitely not easy, especially when you have excess weight. You also have what? Joint pain or muscle pain or things like fibromyalgia. So exercise is very, very difficult for people who have excess weight, all the way to morbid obesity. So when you go to a doctor and you ask him or her, how can I lose weight? The doctor will simply say, you need to go ahead and eat less and exercise more. If you have pain, how are you supposed to exercise at all? In fact, if you need a knee or a hip replacement, neither of these will take place unless the patient has a BMI of 30. If the doctor does the surgery with patients who have a higher BMI, there is a much higher risk that the patient will not make it through the surgical procedure. So this oftentimes is not, it's not informed, or the patient does not get informed of this when the doctor, when they go to an orthopedist or a neurologist to have a hip replacement or a knee replacement. And I'm not sure why, other than the doctor will say, well, you need to lose some weight before we do the procedure. Okay, but how much and how do I go about that? And as I said, oftentimes the doctor will just say, well, you need to eat less and you need to exercise more. I don't know about you, but if I have joint pain of any kind and it impedes me from, walking or moving at all, I'm certainly not going to go forward and do exercises. So let's go ahead and leave the CDC website and go to the American Cancer Society and find out what they have to say about obesity and cancer. So they state that being overweight or obese is clearly linked to an overall increased risk of cancer. According to research from the American Cancer Society, excess body weight is thought to be responsible for about 11% of cancers in women and about 5% of cancers in men in the United States, as well as about 7% of all cancer deaths. That's huge. In addition to the list of cancers that the CDC actually stated on their website, the American Cancer Society adds these cancers and states being overweight or obese might also raise the risk of other cancers, such as non-Hodgkin's lymphoma, male breast cancer, cancers of the mouth, throat, and voice box, and aggressive forms of prostate cancer. Further, the website asks, how might body weight affect cancer risk? That's an excellent question. They state excess body weight may affect cancer risk in a number of ways, some of which might be specific to certain cancer types. Excess body fat might increase cancer risk by affecting inflammation in the body. And we've heard a lot about inflammation, especially in the last couple of years with COVID, because one of the symptoms that COVID creates, and it's really not just COVID that does it, any kind of disease like bacterial or viral will actually create inflammation. And if you have a chronic infection somewhere in your body, that's continuously creating inflammation within the body. The next one they list is cell and blood vessel growth. Okay? So the interesting thing about cancer and cancer tumors is that they send out this information to the body stealthily, and they send it out and they create an environment where the body is told to grow blood vessels to the tumor. And this is the amazing thing about cancer, is that it wants to live inside of the body. And so it requires nutrients just like any other cell. And what it does is it basically tells the body, you need to grow some more blood vessels to me so I can get the right amount of oxygen, I can get right amount of nutrients so that I can continuously divide and grow bigger and bigger and bigger. Also, cells' ability to live longer than they normally would. So a cancer cell actually doesn't really have a stamp goodbye date. So most of your cells in your body, for instance, the red blood cells have 120 to 180 days that they are alive. And they get that stamped the day that they are born, basically. And once they hit that date, they are removed out of circulation and recycled, and the parts are used to create other cells. Whereas cancer cells do not have that recognition. They do not have that stamp on them that they can only live X amount of days or years. So that's a problem when it comes to needing and wanting to get rid of some of these tumors and cancer growths. So the levels of certain hormones such as insulin and estrogen, which can fuel cell growth. So all of us have heard of insulin. Obviously that is a hormone that's produced by the pancreas, and the pancreas produces it in what we call the beta cells. Now, the insulin gets released into the intestinal tract when we consume sugar. And I'm going to be talking a little bit about sugar a little bit later on in the program. Estrogens. So you have E1, E2, and E3 as your estrogens. Now, some of them, I shouldn't say some, all of them are good to have at certain levels. But unfortunately, when we have more estrogens than we should, we can actually create an environment where the body starts producing cancer. I always share with my patients that just as long as you create the right environment and you give the body the right building blocks, you will be able to heal, okay? So with that understanding, if we have a high amount of estrogen in our bodies, and believe it or not, men, we can get high estrogen as well. In fact, believe it or not, I have had husband and wife come in to my clinic and get tested for testosterone, estrogen, and a bunch of other hormones. And I found that once I tested, the female actually had more male hormones and the male had more female hormones. So estrogen is extremely important to not only control in the female, but also in the male. Another factor is to regulate cell growth, such as insulin-like growth factor 1, which is called IGF-1. So it's important to make sure that that's balanced as well. And the ability of cancer cells to spread, which is called metastasis. So when the cancer cells create this tumor, they find that they may run out of some room, and some of them end up getting into the bloodstream and moving to different organs or different tissues throughout the body, and that's metastasis. Now, let's change the subject a little bit. I know that sugar plays a huge role in many diseases. In fact, the clinic that I have, oftentimes I am helping patients to get their hormones in check so that their body will heal themselves. And one of the huge things that is a factor is sugar. And so we really have to control that sugar intake. In fact, you can't get fat without sugar, believe it or not. Now, you can't live without sugar. Understand that, because every single cell requires what we call glucose. And we've heard that. In fact, anytime that you go to a medical doctor and you have a regular blood test, oftentimes they're looking at glucose. How high is your glucose? Well, if it's over 100, actually 99, it's out of range. Those individuals with type 2 diabetes and even type 1 diabetes can have high glucose. And then they also take a look at A1C. So we're all kind of familiar with glucose. And it's extremely important to have enough, but not too much. So on the website, the Scientific American website asks, does sugar really suppress the immune system? Remember, I'm going to talk about the immune system and sugar. And believe it or not, and I believe it, eating sugar may put your white blood cells into a temporary coma. But there's a lot more to the story of how sugar affects our immune system. Now, understand, being an alternative doctor, I recognize the importance of nutrition. At the beginning of COVID, there was some talk on zinc and its importance for the immune system. I found this article on WebMD entitled Zinc. I take any information from WebMD with a grain of salt because it is basically skewed to pharmaceuticals. This information is quite laughable, and with my program, I want you to learn how to discern good information from bad information. So let me talk a little bit about the last statement that that the website made about sugar creating white blood cells going into a coma. Now, the amount of sugar that you take in depends on, the length of the coma that the white blood cells have depends on the amount of sugar that you take in. So you can actually consume an enormous amount of sugar, and those white blood cells will go into a coma for days, sometimes a full week. Now, if you're continuously adding sugar to your body on a regular basis, guess what? Your immune system has decreased in its ability to do what it was designed to do for many, many days. So those individuals who get sick on a regular basis are most likely consuming an enormous amount of sugar. And we're going to talk a little bit about that later on in the program. So on WebMD, the question was posed, why do people take zinc? Well, according to WebMD, zinc has become a popular treatment for the common cold. Some studies have found that zinc lozenges may reduce the duration of cold, perhaps by a day or so, and may reduce the number of upper respiratory infections. Zinc helps fight infection and heal wounds. However, if you already have enough zinc from your diet, it is not clear that getting even more from supplements has a benefit. Okay, so let me address that. First of all, most of us are most likely zinc deficient, okay? That means that we don't have the amount of zinc that our cells require, because it's not only the immune cells that require zinc, but there are so many other biochemical reactions that zinc is required for. And zinc gets used up. And so we need to make sure that we are eating foods that have zinc in it, or we are supplementing with zinc. Now, zinc is, according to this website, topical zinc is used to treat diaper rash and skin irritations, which is true. That's good for those. Zinc has also been shown to help with ulcers, ADHD, acne, sickle cell anemia, and other conditions. I agree completely with those statements. In addition, zinc has also been studied as a treatment for herpes, high cholesterol, rheumatoid arthritis, HIV, and more. However, the evidence of zinc's benefit for these conditions is inconclusive. Now, once again, as I stated in the past, another website was more pharmaceutical skewed. I believe that this particular website is pharmaceutical skewed as well, because there is an enormous amount of research on zinc and the benefits of zinc. But listen to this. High cholesterol. How many of you are listening out there right now and you are on a statin drug? And what is a statin drug? It's a cholesterol lowering drug. Well, just think, if you are deficient in certain minerals and vitamins like zinc, do you think your body is going to be able to regulate cholesterol? The answer is yes. I always tell my patients that you are not deficient in the particular medication that you're taking. You are deficient in a vitamin or mineral or certain what we call phytochemicals, which are plant chemicals that are good for the body. Okay? And I'm not saying stop taking your medications. That's not what I'm saying at all. But I am saying that let's think about this critically. Let's think about, how did our body get to the point that it is? Well, we make choices. And some of those choices create deficiencies in vitamins and minerals. So we have to change those deficiencies. And that means creating a better diet and finding and seeking out someone who can help you determine what deficiencies you have, so that then you can create that balance needed. Now, it goes on, zinc may be part of an effective treatment for age-related macular degeneration. How many of you out there who are listening know of someone who has macular degeneration or has macular degeneration? And it doesn't make any difference whether it's wet or dry. Usually you start out with dry and then you go to wet, and then you have to have these horrible shots into your eyes that are not very pleasant at all. So what if it was as simple as, being zinc deficient? Of course, with macular degeneration, it's a little bit more complex than just being zinc deficient. But that is one of the minerals that are important to maintain the macula of the eye. It goes on, healthcare providers may recommend zinc supplements for people who have zinc deficiencies. Strict vegetarians, alcohol abusers, and people who have a poor diet at higher risk for zinc deficiency. So are those with certain digestive problems such as Crohn's disease. Now, the interesting thing about Crohn's disease, colitis, and diverticulitis are all, believe it or not, deficiencies of certain nutrients depending on the person. And that's one of the things that I do, is I evaluate the person, I evaluate their blood chemistry, their urine, and find out what they are missing. And then we provide it to them, and diseases like these start to resolve themselves. Now, one of the things in this information is the author is assuming that all people are getting the zinc they need from their food. If they are eating high, simple sugar foods, as I call lovingly carbohydrates, they are certainly not getting zinc. And the little that they are getting is being used up quickly. So zinc is extremely important for strong immune function and must be received daily through food. If you eat all of the boxed, canned, and bagged food in the center of the grocery store, you are not getting, you are getting the sprayed on zinc. But understand that all of that is not high quality zinc, and is quickly is depleting your zinc stores. When was the last time your doctor ran a zinc blood test on you? Never is usually what I hear. Why? Because most doctors do not understand the significant importance of proper level of zinc in the body. So let's discuss sugar and the immune system. Remember, I was going to discuss that. We're here. I'm not going to sugarcoat this information. If you are eating sugar, you are decreasing your immune system, period, point blank. Some studies have shown that the sugar stops and depresses the immune system, as I said toward the beginning of the show, significantly for hours to days. You may be wondering why you are a person who gets sick all the time. Ask yourself, am I eating sugar every day? Think about all of the boxed, canned, and bagged foods that you are eating. Maybe one of those foods is, dun 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 dun, Cheerios. So, one of the things that drives me nuts is that Cheerios is supposed to be what? Heart healthy. How many of you are eating Cheerios on a daily basis? So I'm going to talk a little bit about Cheerios. So right now I have a picture of the side of the box that has the ingredients for Cheerios. Remember, we're talking about sugar content, right? And so if this were a heart-healthy food, then there would be very little sugar in it. So I'm going to read you the ingredients. So anytime the product has ingredients, the first ingredient is the most ingredient, and then the second is the second most, the third most, etc. So the first ingredient in Cheerios is whole grain oats, okay, which is not bad. But then the second ingredient is sugar. The third ingredient is cornstarch, which breaks down into the body as, guess what? Sugar. The fourth ingredient is honey, which is okay. It's not great if you're already adding a whole bunch of sugar. And then the fifth ingredient is brown sugar syrup. And then you have salt, tripotassium phosphate, canola and sunflower oil, and natural almond flavor. And then they spray on these vitamins and minerals, calcium carbonate, vitamin C, iron, and zinc, AB vitamin, vitamin B6, B1A, vitamin B2, AB vitamin, B vitamin, B12, vitamin D3. Okay, remember, these are all sprayed on. These are man-made vitamins. And so this is not good at all for the human body. And then the last thing on the bottom of the box, it says, contains bioengineered food ingredients. So what bioengineered food ingredients means that they are basically corn that has been, or oats that has been genetically modified. So my recommendation, if you are taking or eating Cheerios, you need to stop eating that type of carbohydrate. You need to think about the stuff on the outside of the perimeter of the grocery store, because all the stuff on the inside is literally filled with sugar. Start reading labels to see what you are consuming, and if you need a chemistry dictionary to know what you are eating, put the product back on the shelf. Now, vitamin water, sports drinks, and sodas all have horrible amount of sugar in them, and the diet stuff actually makes you gain weight. Yes, you heard what I said. That is another show to be sure, but if you are drinking diet soda, you are just adding to your weight. So as for zinc supplementation, you really need to get a high quality zinc supplement. Unfortunately, most of the over-the-counter, like drugstore or big box stores, do not have high quality zinc. Now, understand that if you are looking for a doctor who can actually take a look, a deep dive into what's going on with your body and make recommendations in order for you to heal your body, I am always here. I have a clinic here in Clinton and one in Preston. And the phone number for my clinic in Clinton is 563-241-8760. And I look forward to hearing from those who need my help. But unfortunately, I have run out of time. So, as always, strive for healthy living.
You're listening to AM 1340 K.